So I've been experiencing some frustrations with the current system that I'm currently using in regards to exercise programming and the efficiency, the effectiveness, and the ability to scale as well as to use data analytics with my current workflows. And I'm on vendetta to be able to solve these issues. I know that there's more efficient platforms and more effective ways that I can better provide care to the patients, clients, and athletes that I see. So the three questions that I want to answer within this tutorial, this voiceover, is one, what are my current operations? Two, what are my plans for the future? And what are my specific needs and or frustrations with my current system? So let's talk about the current operations. So when my current operations is I utilize Word as a means for almost like a way of building out my current program. It's really more of a canvas. For instance, you can see here on the left-hand portion of the screen is I have all these different variations. Specifically here are examples of lower body. So I have lower body workout with a buffet of exercises that can be plugged and played into the sections below. This allows me to have at least a single template that can very quickly be applicable amongst a variety of different patients. And you can see as I click through that there's a variety of different variations here. So I've already tried to scale this to some extent, which has been somewhat beneficial and certainly moved me forward in this progression. Additionally, you can see that I also have examples of different body regions. So if we look at cervical, for instance, I guess that was a bad example, but something like this would be a cervical examination. And this patient had cervical and shoulder, and you can see that this goes on, and that I've accumulated over 600 pages of different programming organized by the body regions. I have specific templates, so it usually goes body region, template, and uh, different phases within that said progression. Then I go patient-specific routines, non-operative versus operative, and so on. And then my current workflow is that I would either most likely print this out for the patient and or copy and paste it into their EMR, but most likely it requires them to have a printout. But this is seemingly labor intensive means and not certainly efficient. It should be within a single click, or even whether they could have a live dashboard for this. But that would, instead of having 600 pages, I would have 600 files and one for every patient, and that also proves to be challenging because then I would have to copy and paste from one Word document to the next rather than having it all in one place. So this is my first headache, is the ability to efficiently and effectively scale. It would be wonderful if I could edit this and the patient would see it in live time in its immediacy. Let's talk about a specific example. So this patient with patella tendinopathy, this is a more detailed program that I've laid out. So you can see that this is his phase 2 of his routine, and it's got a 2-week cycle that consistently repeats itself. And as I scroll down, this is how I've kind of laid this out for him, a more elaborate than my last example, but you can see the template as is. So this would be a specific workout in and of itself, where you have the warm up, our recommended isometrics, then functional strength exercises, optional cardiovascular conditioning, and then muscle and mobility. Again, I'm happy with the template. It looks professional, it's clean, but it's labor intensive, especially if I was going to do this, say, for 70 plus patients in a given week, and then multiply that by the amount of weeks that I see, and the granted that I don't see the same 70 people every week. I'm looking for a means of, again, efficiently and effectively scaling this, where, again, I could potentially use this as a template, but does involve saving this as another Word document, manipulating it for that patient, which, again, formatting and etc. and exercise selection. Again, I am schooled and privy to utilizing Excel, where I could potentially just have like drop downs and changing this. I just haven't transmitted this specific document over to that, but that would be certainly a better solution than what I'm currently working with, and I certainly have plans to do that. All right, finally get into the EMR, so the electronic medical record that we currently use. You can see this looks very similar to the Word document because it is the Word document. I've simply copied and pasted it over here so that it would be, because I usually don't have access to the Word document. The patient is currently in front of me, so having it in the EMR is advantageous not only for me, but also for them because it's a reference that we can consistently come back to over time. And so now you can count them. So I have the Word document. I have to print it off. I also have to then copy and paste it into the regiment here. And then finally, so our actual home exercise regiment or routine program that we currently use is something called Physiotech. So let's pull up Physiotech and take a look at what that is. So here's an example of a patient where you can see what it does allow some functionality. Specifically, it allows me to build out templates, which is nice. Set this as a template, but then again, this is as much as it has. If I go to programming, sorry for a second. Okay, so here's an example of a profile. It's actually my profile. So we have multiple, I'm able to prescribe multiple different programs, which is great. So you can see I've populated a couple like knee exercise or knee clinic exercises, home exercise program, and so on. I can either manipulate the sets and reps by selecting multiple, changing this up here and all selected. I can also have the ability to drop out exercises. I can create a template, as you see here, from what I've already assigned as a program, which is somewhat nice, but it doesn't have the functionality. If I wanted to say, what if I wanted to have multiple days per week? There are different programs, so then I would have to come back to the programs and I'd have to create a program for each given day, and I would have to say Monday and then Tuesday, and then if that day doesn't work for someone, then the same template that was labeled Tuesday needs to be changed. Additionally, so that in itself is inefficient. It doesn't have a somewhat of a calendar view or even like a potential week where even I could have an arbitrary day one, day two, day three, etc. And then within the forms, though this is a new function and though it's beneficial, so let's pull up a similar document that we saw previously. For instance, for the lower body, so we schedule lower body, etc. So I can preview that, and it becomes a PDF that then links to their Physiotech portal. However, it's somewhat, I've gotten the feedback that it's somewhat convoluted for the patient, so that they have the PDF, and even though I lay it out in a weekly program, such as, let's see, so say I do a weekly schedule like this, preview that. So even when I lay it out like this for the patient, where I have, okay, here are your interventions, here are the days of the week, here are the specified exercises you do as denoted by the X's, and then I have some quad specific exercises that are broken down into tables and strength exercises. So they have to go from this and then make sense of it by looking at something like this. And it's just been really, very difficult for them to do so. Even when I do my very best to print out all the sheets all at once, I hand it to them, which again is a waste of resources, time. It's inefficient. So these, you can see my current struggles in the workflow that we currently have. If I was going to name these specific headaches, it would be as follows. So inefficient, knowing exactly where the patient is at when they come in. So say I don't see a patient for 2 weeks and I have 12 people on the schedule for that day. The amount of time that it takes me to then go back and look at these different resources, though I am elaborate in my notes, it is still, and even I write elaborate plans of doing this, that, and the other. There's additional bandwidth, time, efficiency, inefficiencies, and effectiveness that is lost when I know that I can work at a much higher capacity than I currently am because I'm currently being bogged down with this current system. Finally, the ability to quickly scale the program to similar patients. So there should be a set template for post-operative patients that fits 80% of them, and by happenstance, we actually have a very robust workflow for these patients already built in, yet there is still additional time and efficiency being lost within the system because of the multiple systems that this is done across. Ability to quickly disseminate programming directly from a single interface. So it would be wonderful if I had like the ability to do so potentially from either the Word or what would be in Excel that would also link or be a part of the software that you see here with Physiotech, but unfortunately that's just not the case. Um, Finally, the multiple systems, as I mentioned, right? So using Word and or Excel, electronic medical record, Physiotech. I should also put like hard copy, right, is another form, and it's just um, it's getting the job done, but at an extreme cost. And I'm looking for efficiency, effectiveness, and also delivering a very high level product that enhances patient outcomes as best as we possibly can. And I just feel like I'm falling short of those expectations. Lack of a dashboard and data analytics. I would also, and this gets to the second question of like future and what I hope to build out and what I hope to expect from my practice would be something such as this. So you see a lot of these popping up not only in softwares, but where you have people who are adept at coding, either VBA or just within Excel, and being able to build an analytic dashboard such as this. This is exactly something that needs to happen within sports and performance and orthopedic rehabilitation. It should be here now in its immediacy, and I know in some settings it currently exists, but I would say that we're currently spoiled in the sense that we work in one of the most, I would like to think, one of the most cutting edge and novel institutions here at Stanford Healthcare, and yet we're still not even close to building something like this on a large scale. And there's multiple barriers for this, being HIPAA and EMR and somewhat challenging bureaucracies and EPIC and such that have prevented this. And so this would be something that I'm interested in incorporating within our rehab. I think it's an absolute necessity. I think that that's where the future needs to go. And then if we jump back to those final couple points. So limited capacity for marketing. So the current system that I currently use does not allow for me to market beyond the confines of the setting that I'm currently in. Again, we only have one life, and if I'm trying to reach and benefit as much of humanity as I possibly can, then having something that can be marketable and scalable in the transmission of knowledge and information is really what I'm striving for. Limited capacity to use the current system beyond the confines of the one-on-one care. So, high, more and more people are going hybrid. I think that this is, as we get more tech savvy in future generations, it's only going to be a further thing. I think that it is a combination of both in-person and hybrid remote monitoring and remote training. It is potentially the best of both worlds, especially as AI is kicking off, and we'll be able to use remote monitoring and motion capture systems and other high-level forms of biofeedback to ensure execution of exercises, etc., and even program accordingly based off that information is something that I foresee, but I can't currently do that with the current system, and I'm hoping that you could potentially help me out. Thanks.